Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the third video of repeat revision course of community dentistry, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about fits and fissure sealant in detail. Now first we start from definition of fits and fissure sealant. How we define fits and fissure sealant? A cement or resin material that is introduced into unprepared occlusal pits and fissure of caries susceptible teeth, because it is given in caries susceptible teeth, forming a micromechanical retention. Remember, it form a micromechanical retention. In last NLE exam, this MCQ was come in March. Pits and fissure sealant form which type of retention? Micromechanical retention and physical protective layer that acts to prevent the demineralization of enamel. How? By blocking the interaction of cariogenic bacteria and their nutrient substances, thus eliminating the harmful acidic byproduct. This is the definition of fits and fissure sealant. Fits and fissure sealant, it is a cement or like jassy, and it may be composite, flowable composite like resin material that introduced into unprepared occlusal pits and fissure of caries susceptible patient, make micromechanical bond and protective layer to prevent the demineralization of enamel by blocking the interaction of cariogenic bacteria and their nutrient substances, thus eliminating the harmful acidic byproduct. Now come to the indications of fits and fissure sealant. There are 3 indications and 3 contraindications. First indication is if there is a sewn deep pits and fissure. If there is a deep pits and fissure and sewn normal, no caries. Second is a recently erupted teeth. Third, patient who are highly susceptible to caries. Now come to the contraindication. If there is a carious pits and fissure. Next, if caries extend on other surface of the same tooth like buccal, lingual or palatal surface. Third, when large occlusal restoration is already present, then where we can give pits and fissure sealant. This is contraindication. Now come to the types of pits and fissure sealant. In last NLE exam, this MCQ was come. First generation pits and fissure sealant is ultraviolet activated, visible light activated or chemical cure. This is very important. Now types of pits and fissure sealant. First we make types on the basis of generation. There is a first generation, second generation and third generation and fourth generation. The first generation is the, remember, first generation and third generation both are light activated, but first generation is the ultraviolet light and third generation is the visible light, and second generation is a chemical cure or autopolymerase pits and fissure sealant. The fourth is the fluoride containing, fourth generation is the first generation, second generation, third and fourth. Fourth is the fluoride containing sealant such as GIC sealant, and this MCQ was also come. The fluoride containing sealant is GIC sealant. Now after types on the basis of generation, now come to the types based on filler. Either fits and fissure sealant free of filler or contain filler. If free of filler, this have better flow to flow into pits and fissure sealant. To flow into pits and fissure. Second is a semi-filled. This semi-filled are more resistant to wear, loss of surface material. Now second, based on color, there are 3 types: clear, tinted and opaque. Clear is difficult to identify during follow-up because there is no difference between teeth and pits and fissure sealant. Second is the tinted, they are colored, easily identified, and third is the opaque, they are also easily identified. Next, based on material, the composition of pits and based on material composition, there are 4 types of fits and fissure sealant. Number 1 is the bis-JMA, which is bisphenol glycidyl methacrylate, which is a resin. Second is the cyanoacrylate, third is the polyurethane, and fourth is the glass ionomer sealant. Now, after types, now come to the for maximum retention of sealant, the following factors are to be viewed. There are 6 factors for maximum retention. Number 1, tooth should have maximum surface area. Second, presence of deep irregular pit surface. There should be not a shallow, there should be deep irregular pit surface sealant in order to lock in this their irregularities. Teeth should be clean and absolutely dry and not contaminated with saliva. Number 4, types of sealant use. And number 5, age of the patient. And number 6, for maximum retention, clinical skill of operator is also necessary. Now come to the procedure. There are 10 steps in application of pits and fissure sealant. Number 1, first, polish the tooth surface. If there is any calculus plaque, remove that. Second, isolation and drying of surface by rubber dam. Third, are also by the help of cotton roll. Third, etching by using 37% of orthophosphoric acid for 15 to 13 seconds. Remember, this MCQs also was come how many percentage of orthophosphoric acid are used for for pits and fissure sealant. We use for 15 to 13 seconds. You remember the duration, and 37% orthophosphoric acid, not phosphoric acid. Like in etching of composite, we use phosphoric acid, but here orthophosphoric acid. Remember. Number 4 step is the rinsing the tooth surface for 15 seconds. For 15 to 13 seconds, orthophosphoric acid application for etching, same rinsing also for 15 seconds. 5th step is after rinsing, isolation and drying of surface. Number 6, applying bonding agent. Number 7, material application. Care should be taken to prevent ear entrapment. Next, 8, evaluate the sealant. Number 9, check occlusion. If there is a high spot, remove that. And number 10, recall and periodic maintenance of the patient. Now, this is all about pits and fissure sealant. Now, today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.